Hi, Dr. Shakib here from Irvine Spine and Wellness Center. I am here with my buddy Ian, and just wanted to demonstrate to you some of the stories behind some of my patients. And with that said, Ian, can you tell everyone what brought you here initially?
Many years ago, I used to play shot put and discus, and I got an old injury in my right shoulder. That caused me to not be able to use my right shoulder to its full efficiency. And then soon after that, my wrist started to hurt, and my parents thought it was carpal tunnel. So what they thought was best was for me to come here to get a consultant on it. Saw Dr. Shakib, and she looked at my wrist and she was like, not carpal tunnel, but it's something that I can fix. And same thing with my shoulder.
So shoulder and wrist brought you here. What was it? How long did you have that problem?
Roughly 3 years.
Holy moly, 3 years. And what had you done about it up to the point that you saw me? Had you seen any other providers?
I have not.
So you never saw a physical therapist for that? You didn't do anything? You just thought the pain is going to go away?
Yeah.
Okay, that's interesting. Nothing new to a lot of patients that I see in my practice, that, oh, you just kind of bear it and the pain will go away. So did the pain, was it constant or was it coming and going?
It was intermittent.
Intermittent. So that's a point where pain goes away, you think everything is good, but it kept coming back. What was it stopping you from doing?
Honestly, occasional everyday chores, like trying to lift something heavy up over my head and trying to put it away. I couldn't do it. I'd have to use my left.
So you learned how to modify your activities based on the limitation, which is yet another common trait among my patients. So Ian, when you did this, before you came here, and obviously your parents referred you to the practice and the style of my practice. Now, before you came here, were you afraid or did you have any fears or anxiety over starting care?
Nope, not at all.
And it probably helps to get a referral to go see a provider, I'm sure. Now, we have just started care on these areas, and we're working towards the brain-based neurology and posture, activating the weaker part of the brain with regards to the posture. Now, I believe you had seen other chiropractors before, right?
I had.
And
they weren't for the same issues, though.
Right. And what, in your opinion, since you've had other references, what made your examination at the office, at this office, different from the other offices? What was unique about your examination here?
Honestly, it's more informative here. Like, you tell me each and every individual piece of my body that is malfunctioning. And my other chiropractors did not. They said, oh, I can fix it. They didn't tell me what they were fixing.
Because after all, the whole goal of the practice is to really empower the patients with what they need to do. You're with yourself all the time. I'm not with you all the time. So it's very important for you to understand the signs and symptoms and what they mean and how your body's communicating with you. So what part of your examination here was like, whoa, what the heck? When I was doing my...
Honestly, the funnest one was being able to close my eyes and march in place. And as I did that, my feet went completely right.
I think you were almost like 90-degree angle to where you started, that's a sign of a weaker vestibular system on the right side. You don't need to know about this. These are the things that will help me understand what exercises for the brain, just like exercises for the body parts, what exercises for the brain are necessary to activate it properly so the command center can send the command to the body parts to perform. That test is, in Ian's case, showed vestibular system on the right side of his auditory nerve needed to be stimulated in a positive way, so it comes back to the picture and play its role in giving information to the brain for better balancing and posture. Why is that important? Obviously, as you are deviating from the way your body is designed to move, you put yourself in a position of injuries and re-injuries and chronic issues. So, Ian, what is it about your visits here that makes you look forward to your visits, if any? And it's okay if you say, I don't.
Honestly, I see improvements in myself each and every time that I come in here. One of the exercises that she's had me work on is going into a 3-month-old pose. And
Yes.
getting into that 3-month-old pose, you're working out muscles you never knew you would ever work out.
Very true. This is a prelude or a combination of what I do with my brain-based neurology and posture examination and treatment, because everything is connected. We all know about that. But as we're working on activating the weaker parts of the brain when it comes to posture, it's also important to work on other preliminary things that need to be worked on. So when we're going with the full force examination, exercises for the brain to improve and rehabilitate not only the body parts but the brain with regards to posture, everything comes into the picture. What Ian is describing has to do with dynamic neuromuscular stabilization, just a whole different thing that I incorporate with my care regardless. Well, thank you so much, Ian, for sharing your story here. And what would you say that at any point in the practice you are forced into doing something you don't want to do, or there is any, I don't know, you feel like you're being pushed?
No, not at all.
I think if anything gets pushed is
it gets painful.
It's painful because you're working out muscles that you're not used to working out. Not that I'm painting him, but
it's nothing that I'm being pressured into.
Absolutely. Well, thank you so much for sharing this.
Anytime.
And thank you for watching. And if you have any questions, don't hesitate to contact me. You take care.